Hello, today we're going to continue with our radiology MSK sign series, and today we're going to talk about the bone blister sign. The bone blister sign we see in aneurysmal bone cyst. In this pelvic radiograph, we have an aneurysmal bone cyst centered within the right inferior pubic ramus, which looks very different from the normal appearing left inferior pubic ramus. Aneurysmal bone cysts are osteoclastic and telangiectatic lesions of the bone. And what happens is that you have bleeding within the bone, and that bleeding causes expansion of the bone. And when that bone expands, it loses the trabecula within it, and it kind of looks transparent. And that expanded transparent bone almost looks like a blister, or so they say. And that's why we have the bone blister sign. So aneurysmal bone cysts in MRI show characteristic fluid levels both on T2 and T1 weighted images. We see different signal intensities both at T2 and T1 at these fluid levels because it is related to blood products in different stages of decomposition. In MRI, we can also see the bone expansion as we see here with bulging of the medial acetabular wall causing minimal mass effect upon the true pelvis. This bone expansion can be marked as we see here in this coronal image that looks extremely different from the normal appearing left side. And we can also see the fluid levels as well as the bone marrow edema associated to this large aneurysmal bone cyst. So aneurysmal bone cysts are telangiectatic osteoclastic lesions of the bone that are usually associated to other underlying lesions, most commonly seen with giant cell tumors of the bone. But we can see them associated to other lesions such as chondroblastoma, bone cyst, and fibrous dysplasia, among others. In radiographs, aneurysmal bone cysts are expansive, well-defined lesions that may show this blowout appearance due to the expansion and can even cause cortical breakthrough and pathological fractures. In MRI, it shows these characteristic fluid levels because of the presence of blood products at different stages of decomposition. So, aneurysmal bone cyst expands the bone, loses the trabecula, looks kind of transparent, which looks like a blister. So we have the blister bone sign, as seen with aneurysmal bone cyst. Now you know.